is Amy Grella, and I am a member at Bower Hill Community Church, where I work with our children and youth. I want to talk to you about a nonprofit, Undue Medical Debt. They work to eradicate systemic poverty by buying and then forgiving medical debt. This organization is deeply personal to me. 10 years ago, my family and I found ourselves overwhelmed with debt due to my daughter's health struggles. At just 4 months old, my daughter contracted RSV, a respiratory viral infection. In response, her body learned a natural defense to tighten the muscles in her airway, constricting her breathing. Anytime my daughter had any kind of a viral infection, even just a common cold, her throat would close, impacting her breathing, and we'd be back in the ER. When your child is struggling to breathe, you know you need to get help. My first thought was not, how are we going to pay for this, especially when we had medical insurance. At that time, both my husband and I were working. However, when our daughter turned 2, I chose to stay home in order to focus on my family. As a result, our insurance changed, and thus began the downward spiral into medical debt. Let me be clear, we were never without medical insurance, yet our claims fell into insurance policy loopholes and exclusions. With 5 hospital stays before she turned 5, our medical bills racked up. Thankfully, her doctors found and prescribed a daily medication to manage her condition, keeping us out of the ER. However, insurance did not always cover this medicine, and we found we were struggling to pay the out-of-pocket expenses as insurance denied claim after claim. We went on a payment plan and were paying back our medical debt. However, at some point, this debt was sold to a collection agency. While I didn't get a letter telling me this had happened, I distinctly remember knowing when the shift occurred. Once the medical industry sells patient debt, they have collected payment, they're done. They no longer care how their patients and families are treated. All of a sudden, a debt collector began sending scathing letters, calling every day, sometimes multiple times a day. They were not kind. They would yell, threaten, try to intimidate and scare me. This was before caller ID, so I didn't know who was calling, and it made me afraid to answer my own phone. It honestly made me feel less than human. It was one of the most stressful times in my life. Undue Medical Debt is an organization that purchases medical debt and keeps it out of the hands of debt collectors. They target people who earn 4 times the poverty rate. In other words, people who can look like me. I cannot tell you the peace of mind that it would have given me to receive a letter saying, "I got you. Your debt is forgiven. Go focus on keeping your child comfortable." We're asking you to get involved by, number 1, raising awareness of this campaign, and secondly, by donating. Medical debt is a main reason people go into bankruptcy in the US, and the average medical debt is just $1,000. So your $10 donation can eliminate one person or family's medical debt. Our goal is to raise $65,000, which will eradicate over $11 million in debt. This is very achievable if each member of Pittsburgh Presbytery would donate at least $5 and then talk to 5 people and ask them to do the same. In Matthew 25, Jesus tells us, "Whatever you did for one of the least of these brothers and sisters of mine, you did for me." Lord, let it be so.